In the United States, suicide is the second leading cause of death among our young people. It is the number one preventable cause of death among our young people.
I've lost multiple people in my life to suicide. We have many dear friends who lost their children to suicide. I lost my dad to suicide.
We know that prior to graduation from high school, that 20 to 25% of our young people, prior to getting that diploma, walking across the stage, will have struggled with some form of depression. We know that in any given year, somewhere between 15 and 20% of our young people, prior to graduation, will have considered suicide. Two to 3% will have made a serious attempt that will land them in the emergency room. And so in a high school of about 2,000 students, you're going to see about 40 or so that landed in the emergency room every year.
My best friend in high school, David, he struggled with tragic mental health issues. The last conversation that I had with him started with him explaining the pain that he's in. And I said, "Are you getting help? Like, are you seeing a therapist? What's going on?" Because I only knew to tell someone that they should seek professional help, right? I had no idea how to carry on a conversation, how to ask questions, how to offer support. And the last thing he said to me was, "It's like bringing a knife to a gunfight." And then he took his life. That conversation replays in my head all the time. It's been 10 years. All of these years thinking that maybe I could have done something and I didn't. It's pretty awful to live with that.
I lost my brother to suicide when I was a teenager, and now working with an organization that prioritizes prevention and early intervention research gives me so much hope for the future state of youth mental health.
One of the things that the AIM Ideas Lab is doing is young people, teenagers and young adults, are the example for their peers of how you can show up for a friend. What does it mean to support someone? What does it mean to just be there for them? I've heard it said by some that this generation is softer. I think in many ways this generation has had to deal with more everyday battles than previous generations. And although youth suicide rates have been rising steadily over the last 15 years, there are more and more resources now available to help us as a community, as youth serving adults, and as peers trying to help their friends to be able to intervene on their friends' behalf.
At my school, we've had a couple of suicides, and we've had to deal with a lot of struggle at our school with people dealing with such an intense mental health crisis. Because of AIM Youth Mental Health, I feel like I am more educated on how to approach situations about mental health, about the crisis. I feel like I'm more comfortable talking about it with people. I understand more. I feel like I have kind of guidelines set for me on how to approach those situations and be there for the people around me.
The move into offering on-the-ground programming funded by AIM came from a realization that while research is critically important, the need at this moment is also critical. And there are evidence-based programs that work. And AIM's new Suicide Prevention Fund will allow AIM, its board members, its researchers, its experts to be incredibly nimble with research opportunities as they arise, and also with programs on the ground with youth mental health first aid and adult mental health first aid to ensure that our entire community knows what to do when someone in our lives is in crisis. There's something you can do today. There's something you can do right now to impact your peers, your friends, but also the next generation of young people who need it.